schools.
And Pamela, so sorry, I'm about to go live and I'm letting the congressman in right now.
Gotcha.
Thank you. All right.
Morning, Pam.
Good morning, Dr.
I am well. How are you this morning?
I'm excited.
I am too. Can you hear me?
Yes, we hear you well.
Thank you for moderating this morning. Appreciate it very much.
Absolutely. This is an outstanding issue for us to be discussing this morning.
Sure is. Very important.
Very much so. So thank you everyone for taking the time to join us for this very important discussion on keeping our children safe in school as we begin this school year amid record-breaking COVID-19 cases in Florida. Again, Florida is the epicenter of the nation. We also have a recently signed order by our current chief executive banning mask mandates in schools. I am Pamela Birch Fort, Senior Advisor to Charlie Crist campaign for governor. And joining Governor Crist today for this discussion is an outstanding panel. We are joined by a parent, a teacher, a school board member, a pediatrician, and a student. And may I ask that each of you please introduce yourselves.
So I guess I can start. My name is Dr. Lisa Gwynn, and I am a general pediatrician at the University of Miami Miller School of Medicine, and I'm also the president of the Florida chapter of the American Academy of Pediatrics. And thank you for inviting me.
Absolutely. Good morning.
Good morning.
I can go next time. My name is Jabari Hosey. I'm a parent of 3 children, 2 in public school here in Brevard County. And I'm happy to be here.
Very good.
Hi, good morning. My name is Andres Serrato. I'm currently a teacher in Miami-Dade County and also a parent as well.
Good morning. Welcome.
Hello, my name is Stephanie Cox, and I'm also a parent. I have a child entering 5th grade here in Pinellas County Schools, and I'm interested in keeping him safe. So thank you for giving me this opportunity.
Very good.
Hi, my name is Camila Cruz, and I'm a student in MDCPS at Terra Environmental Research Institute. I'm a rising senior at the school.
Thank you so much. Let's just jump into this conversation by turning the mic over to Governor Crist for some opening remarks. I know this is going to be a lively conversation for us. Governor Crist.
Pamela, first, let me thank you and all of our guests that are with us this morning. Doctor, to a teacher, to a parent, and a student. Very important topic. Obviously, we're talking about children's safety and school safety. Most of the schools in Florida open next week. That'll be about 2.8 million. That's an awful lot of young people. They are precious. We care for them carefully. Goes that we're experiencing horrible spike in this pandemic, primarily surrounding the variant, Delta variant that we're so, you know, I think, Pamela, with your great leadership, we can go around the panel and get different perspectives on how people feel very strong. Safety first. We're taught that as kids, and but we'd love to hear from the panel, and then we can wrap up on the other side. Thank you again so very much.
Absolutely. Let me start with Dr. Gwynn. What are our children walking into?
We're not sure exactly what our children are walking into. There's confusion. There is a lot of volatility. There's a lot of opinions. And so our children have been faced with so much over the last year. And what we want to try and enforce and promote is that we do our best to ensure our little children and our adolescents, that they are safe. And how do we do that? The only way to kind of arm them with a sense of safety is to make sure that they wear a mask and get vaccinated. Those are the only two ways. If a child can get vaccinated, they should be. They will have a sense of freedom and safety, because a lot of children live with the fear. I mean, everyone's kind of living in fear right now. So that's really what the message that we're trying to promote to parents, is that to just instruct their children that this is the best way to keep them safe, and to just try and go back to school and live their lives again. They haven't been able to live their lives the way they were pre-pandemic. And so being back in person is allowing them the opportunity to be in person, to be able to interact with their teachers, with their friends, and have socialization. So I know that's a long-winded answer to your question, but these are the key things that we are trying to promote for parents, so that their kids feel safe.
Thank you. But what I hear you say is that masking up and getting vaccinated follows the science.
That is exactly correct. We are science-based. We go by data. There have been studies that have been conducted since the beginning of this pandemic. And so we are learning more and more every day about what this virus can do. And unfortunately, we're starting to now see the data is coming in that the virus is trying to outsmart us. And so we're in a race. We're in a race because it's becoming more and more deadly and more contagious. And the only way out of this, there's no other way. The data is clear that we have to protect ourselves by face coverings, other mitigation strategies like hand washing and distancing, and most important, vaccination.
Very good. Thank you.
Just a quick question for the doctor, and thank you again, Dr. Gwynn. So you're a pediatrician by training, right?
Yes.
How long have you been a practicing physician now?
22 years.
Wonderful. Thank you. Thank you.
So I think the governor is commenting on the fact that you know science.
Yes, and actually what I do, my programs at the University of Miami, we go out into the community utilizing mobile units to immunize the underserved. We also have school clinics in Miami-Dade County in which we immunize children within the schools. So we are working very hard in the community to immunize as many children and adults actually as we can. And so we are seeing firsthand out in the field the importance of vaccination, and also helping to alleviate the hesitancy among parents, and because they do have a lot of questions, and it's rightfully so. I mean, I'm a parent as well. I understand their fears. And so, we have special teams that are going out into the community to try to deliver culturally sensitive information to help parents to make the right decisions for their children.
Very good. Thank you. And in our haste to jump right into this conversation, we missed the introduction of our school board member, Ms. Leonardo. Ms. Leonardi, will you introduce yourself?
Yeah, I'm Sarah Leonardi. I'm the school board member for Broward County's District 3.
And if I'm not mistaken, the Broward County School Board passed a mask mandate and then had to retreat from it. And if I'm not mistaken, that was a unanimous vote by your board?
Right. There's been a little bit of confusion around communication around that, but last Wednesday we did unanimously vote to require masks for the start of the school year. 2 days after that, the governor did issue his executive order, as you guys referenced before. But today we put out a statement that we are still waiting on seeing the rules of this emergency order. And I'm one board member who's interested in exploring legal challenges to this executive order. And so for now, the mask requirement does remain in place.
Excellent. That's a pretty strong statement. And I assume that your board are very focused on keeping students safe, and you feel strongly that masking up is the best way to do that.
Yeah, I mean, last year we had very, very minimal spread in our schools, and it was because of very simple safety measures like masking, washing hands, social distancing. And, as we are welcoming all students back into the classroom physically, masking is going to be the safest way to keep them healthy and alive.
Excellent, excellent. And Mr. Hosey, I believe it's correct that you have already experienced some of this by sending your son to summer school, where some children were masked and others were not. Can you share a bit about that school experience with us?
Yes, I can actually. So I have two sons that actually attended the summer program. Initially, in a year prior, they were e-learners, as that was an option, and then we switched them to in-person, and they spent majority of their time in person when masks were required within the schools. So when they removed that mask mandate, we kind of were at a crossroads and decided that we still wanted them to attend the summer program masked. So they were the minority at the school in terms of masking. And my eldest, he actually contracted COVID within a month and a half of attending that within the school grounds. He was one of many, actually, which has been presented to us. There were 11 students that day that tested positive as it spread throughout the school. So he wore his mask, others did not. So it unfortunately, he was collateral damage to the fact and the science that both parties need to wear masks in order to prevent this from occurring.
Have you made any decisions on what you're going to do entering this school year? I imagine that must be very tough on you.
Very much so. Not a lot of sleep. So we have been taking action in terms of a part of a masking group here in Brevard with parents and teachers and concerned citizens, where we're trying to present our last ditch effort, I would say, for Tuesday's board decision. But in terms of us personally, it's kind of up in the air. We have them prepared to attend a private school that requires masks, but we would of course like them to attend our public school, which is here in our neighborhood in Brevard.
Excellent. Ms. Cox, I know that you have children as well, and indicated that you are looking forward to trying to keep your children safe. What are your plans for entering school this year?
Well, so my son is going to be starting 5th grade at the school his neighborhood school that he's attended since kindergarten. He did online learning for a while last fall and really struggled. He was unhappy, and while he performed well academically, he was in tears every day. He just was lacking the social interaction. He was missing his community, his school community, his teachers, his friends. So we made the difficult decision last year to allow him to go in, and he went in, and there were actually COVID cases in his classroom, but everyone was wearing masks and there was no spread. He did not get COVID. And I am incredibly grateful for that. He is a high-risk kiddo. Right before the start of the pandemic, he was diagnosed with type 1 diabetes. So I spent 3 days at his bedside at All Children's Hospital in the ICU, praying for his health. And so this has been an incredibly stressful time, trying to balance his mental health with his physical health. And I'm concerned. I know that he's 10, he's not able to be vaccinated yet. I know he's getting to the age where peer pressure is something that is something fierce. And so if some of the kids aren't wearing masks, I'm willing to bet that a lot more will decide not to either. And so, you know, we're struggling. As of right now, he's planning to go face to face, but it's keeping me up every single night. I told him he couldn't do safety patrol this year because it just involved too much contact, and he was okay with that decision. But we're just hoping and praying that Pinellas County Schools will have an emergency meeting and at least discuss the possibility of having kids wear masks again. And I'm just hoping for our leaders to be leaders and make the tough decisions and keep our kids safe, so that we can have a good school year.
Well, thank you for that. And I'm really sorry that your son has to struggle with some of these issues. And I hear each of you speak to that your children are struggling, your children are frustrated about what's going on. Let's get our student in here. Camilla, you have to go back into the classroom today. And I know that all of this discussion about whether to mask or not to mask must be frustrating to you as well, especially given the fact that you have to focus on your education. How can you do all of this? How can you worry about your safety and focus on your studies? Share some of that with us today.
Well, I'd like to say first that I agree with everything that's been said so far. I agree that masks, based off of the science, I'm a student more involved in STEM, and I've taken like the personal interest in studying this kind of thing, like the vaccine and the masks, how it prevents the spread. And I think that it's critical. And as a student in school, I'm seeing that the most distressful thing for our education are the quarantines, the closures, the things that we can't celebrate anymore. We can't have award ceremonies. We can't have orientations. Things are on Zoom, and the student body sometimes feel disconnected. I feel it as a student. And I think that sometimes we tend to miss the forest for the trees when we're trying to eliminate the masks because we think that it's going to eliminate COVID, because it won't. It's only going to make it worse. It's going to be like going back to 2020. That's what it feels like to me. I'd rather have masks and try to maintain a social distance and try to go back to normalcy gradually, but not recklessly. I think that we should be strategic in how we go back to normal. And because as a student, I think personally that that's the best. Yeah, we can't guarantee that everyone's going to be vaccinated. We can't guarantee that unmasked individuals are vaccinated. Who's going to ask them in the hallways if they have for their vaccination card? No one's going to do that. And we can't guarantee also social distancing. We can't guarantee that in the stairways, we're going to be 6 feet apart, because I lived it this year as a physical student. And even being vaccinated, I don't feel safe without masks. That's the best input that I can give as a student.
Students always have the best answers.
Outstanding.
Very much so. Mr. Serato, you are going to be in the classroom also. How are you going to handle your students in the classroom? How is any of this going to keep you safe?
Well, one of the things that I think about, like in this past year, I feel fortunate in that a lot of the programs and steps that we had in place kept me safe. It kept our students safe. When we were inside the classroom, inside that school building, we were able to spread students out. And also that was facilitated by the fact that many of our students chose to stay at home and be safe. So in my classroom environment, I did not have that many students. I didn't have the typical classroom load that we normally see during a school year. But coming up now this month, I'm going to be back to that classroom filled with 25, 30 students. And while going into that, I'm like, okay, I feel that I could be safe. But now that I hear that, oh, we're not going to mandate masks, we're not going to mandate a lot of things that kept us safe in the first place. And that's what kind of terrifies me coming into it. And I remember when they first announced vaccinations were open for teachers, I remember running door to door in the school building, telling the other people in my department, go sign up, go get your vaccine. And now we're coming into a situation where my students can also be vaccinated. I'm not going to be sure who is or who isn't, but we are in a situation where we still face the fact that we can be transmissive, as we've learned from recent studies, again, looking at the science. Merely because we are vaccinated doesn't mean that we are free from this. The vaccine works really well at preventing serious death and serious harm. But when I come home after teaching 120 plus students in a day, I also have my son who's 9 years old. He's not eligible for the vaccine yet. And one of the things that I fear the most is exposing him to something when he has gone through every single precaution possible. And one of the things I have to commend our students on is that they have been amazing in dealing with this. In everything that they have gone through, they have been more than accommodating, more than understanding, and they've been willing to comply with so many of these issues. They understand the empathy, the need to take care of our fellow students, not just those in the room, but our families back at home. They understand this. And I feel it's a great disservice to them, not to mention our entire community, that we feel that this isn't something that we should have to do anymore when there is still that much we need.
Very good, thank you. Governor Crist, you come from a warm, loving background with a father in the medical field who has attended to many people over the years. What are you bringing into office as it relates to the science behind masking?
Well, thanks for the question, Pam. I think that due to my upbringing, being raised with a father who was a family physician in St. my hometown for 55 years, a great respect for. I have medical as well. My other sister is in public education. I know. Fortunately, she's in a better. But just a tremendous respect for science. And what I've heard from Dr. Quinn and others is the importance of the vaccine. If you're eligible, obviously, but certainly important and what they can do to stay safe, and our teachers stay safe. I mean, the fact that Governor DeSantis decided last week an order banning masks, trying to overrule, Broward County do so. That's a good. I think it's not a good thing, based on what I've heard this morning, based on what I've read, and in deference to scientists, healthcare professionals, doctors like Dr. Quinn, the people that do this for a living. Everybody seems to advocate in the classroom setting the wearing of masks. I think it's the right thing to do. And I think instead of signing an order to ban them, I think the governor should have signed an order to have them. And, as I said at the outset, Pam, we're all taught as kids safety first. I used to be safety patrol, I heard. Your child. And so I can relate to that. It was all about, trying to do what's good, just, and right, and safe for our children. And I think it's just important that we make sure that our kids are safe. And I guess I would ask you, Dr. Quinn, if it's okay, if you had to come down to it in terms of masks, what would you do, or what would you advise a governor to do in this situation? Facing the fact that we'll have, almost 3 million kids in school next week in Florida, for most of the state.
Yeah, I mean, I think that the science is clear. Everybody has to wear a mask. There's no other way around it. Masking of students, teachers, staff, the entire school population in order to protect everybody and keep everybody safe.
Right, right. Thank you, doctor. Appreciate that.
Mhm.
And I think it was Kamala, the student. You said something, that eliminating masks makes it worse. And then I believe it was Stephanie from Pinellas County who said, we need our leaders to be leaders and keep our kids safe. Anything either of you would like to add to that?
When I voted for you in the past and for my local representatives in government, I trusted that they would represent me at the local level. And my hope is for that form of governance to continue, where local leaders can advocate and make a change, and that edicts aren't coming down from Tallahassee enforcing issues like masks to basically put children's lives in danger, forcing kids to follow rules that maybe on the ground don't make sense with what's currently happening.
And following from that, I completely agree. I think that more factors than science and a genuine concern for education are what's into play when masks mandates are banned. I think that that's something that's disrupting our education and our safety.
Indeed, and we are focused on this issue of keeping children safe in school so they can focus on their education. That is the purpose of our world-class education system. One element and an undercurrent to all of this is, again, the mental health of our students, the mental health of our teachers, and obviously the mental health of our parents at home who deal with all of this. I recently read that there is a new collaboration in the works that involves the American Academy of Pediatrics. They are developing a toolkit to help families and teachers get students ready for school and to perhaps assist with some of these mental health issues. Dr. Gwynn, would you suspect that this online tool would, maybe provide some simple measures that parents could use at home on a daily basis, to help calm their children, to help focus them on understanding that we're trying our best to keep them safe?
Yes, I think it's a great start. And it's simple messaging and lessons that can be kind of taught to parents about how to recognize mental health issues in their children, and things that we've never really encountered before as parents. The things that our children are going to be coming home, the stories that they're going to be coming home to are going to be very, very different than in the past. And so recognizing the signs that your child may not be mentally, as well as they could be, knowing those signs so that they can seek help for their child is really critical. And so we hope that these toolkits that come out are going to be able to assist parents with just having different things on their radar so that they can intervene and help their child as soon as possible.
Right. I recently saw statistics indicating that the national mental health crisis is among students as young as 8 years old.
Yes, absolutely. Absolutely. We're seeing it more and more in the office. And one of the challenges is the services that are provided in the community. And that's something that we really have to deal with on a larger scale, is access to mental health therapy and services. So we can identify those problems, but how do we plug those children into services to help them to get better? That's one of the things that we're working on.
Absolutely. Mr. Serato, you're in the classroom every day with these students. Without mask, with mask, they must be experiencing anxiety as well. How would you, or how are you addressing this in your classroom?
Well, first off, one of the things you have to do is inform them. Like, I feel that a lot of the anxiety that is being felt is simply because we don't know a lot of certainty about things. So one of the things I encourage in my classroom is research, learning from verifiable sources and understanding. And in that, we come together and understand what is that's going on, and we can come to understand why decisions are being made in the way that they are. And one of the other things too is, as things change, as things evolve, we can look back and reflect on what we've done. We don't necessarily get worked up in that we may have been wrong in the past, but we look for is like, what is the best decision right now? And the best thing that I can do as far as like curbing the other forms of anxiety is just to make sure that I can give them the information, but then also focus on the classwork, on their own self-enrichment and reassurance that there are things that we can do to focus on right now in the present that can mitigate ourselves and take control of ourselves. So if we can focus, if we can let loose on the distractions a little bit with so much of the discussion regarding COVID-19, by informing ourselves, we can then really focus on what's going on in the classroom, what history that they need to know. Ironically enough, I am AP government teacher in the county.
Well, I know you have had some exciting discussions on civic education and what that means, and hopefully you have some budding participants in your class that might end up in government. Mm-hmm. Very good. Mr. Hosey, how are you preparing this school year? You went through the summer. You obviously had a close brush with this issue. What are you doing as you ready for the 2021-2022 year?
Well, holding the school board and the officials accountable is the first thing I'd like to do. We as parents, as members of the community, we elect these officials. We expect that they do their due diligence to protect our children and their health while at school. And the first thing is holding them accountable, reaching out to them and expressing that we are, we're not happy with the decisions being made, all the way to the governor, right? The second part is then the focus on the family. We do need education. We like face-to-face if possible. So right now it's exploring the pros and cons of sending them to the school as they're protected with masks, face shield, sanitizer, having them prepared for dealing with the classroom of unmasked children and what that looks like in terms of the peer pressure. Fortunately, we had that experience a little bit in the summer, so we kind of had those discussions with the kids. And if things don't look like, with the trends as they're going and the spread, that we do have an option to potentially move them to a school that is not public, unfortunately, but private, that does require students and staff to wear masks.
Well, I surely hope you don't have to wrestle with all of those issues and decisions as you get ready for the school year. Ms. Leonardi, you, as a school board member, apparently took this very seriously. Your school board put the issue on the table and made a decision. What kind of input did you get from your parents as you all prepare to address the issuing of a mask mandate?
Right. So the overwhelming majority of people who reached out to us through public comment, through emails, through phone calls, was that we should implement a mask requirement. Parents are very scared, at least the ones that I'm hearing from are very scared, especially for their elementary school students who cannot get vaccinated yet. And they were just, really imploring us to make a common sense decision to implement a very simple safety measure, and that's requiring kids to wear masks. And I can say that, in the spring, I was substitute teaching in middle school classrooms, and at no point in time did I hear students complain about masks. So I want to put that out there. It seems like the children are much more responsible than the adults when it comes to doing their part in terms of maintaining public health and public safety.
Well, that's interesting to hear you say that, the students themselves in the classroom are not adverse to mask, and that they seem to understand that it does give them a layer of protection. Governor, I know you have a deep and abiding respect for all layers of government, not only at the state level, but the local, county and municipal level. In your role as preparing to become the chief executive officer, are you going to listen to your school boards? Are you going to encourage your school boards to meet with their parents and allow the school boards to make these critical decisions?
Well, I think they have to be participants. And I think Sarah's comments were spot on, about what they decided to do in Broward. And that kids didn't seem to mind the notion of wearing masks. And going back to Dr. Gwynn, it's abundantly clear to me that the science is clear on this issue, that wearing masks makes you safer than not doing so. And, I can't help but, hear the words too of Stephanie Cox in Pinellas County. We have leaders to lead and to try to make sometimes what may be difficult decisions, but the right decisions. And after listening to this panel and listening to, parents, obviously, teachers included, Dr. Gwynn, school board members, in Sarah and others, it seems obvious that if we're going to do what's right, if we're going to stand up for our children's safety first, then it's abundantly clear to me that the governor should sign a mask requirement for the state. And that's just the right thing to do. And some people aren't comfortable with that. I don't enjoy wearing a mask particularly, but I'd much rather wear a mask when I'm in public or indoors and be safer than not be safer. And so I think in the interest of doing the right thing and doing what is best for our children and giving them every opportunity to not get sick. I mean, Florida's #1 right now. That is a dubious distinction. And to not recognize where we are would be irresponsible. So I think it is responsible for the CEO of the state, the governor of the state, to issue a mask requirement to, as they say in medicine, first do no harm. First do no harm. Doctor, you're probably much more familiar with that than I, but it's what I learned from my father and my doctor sister as well. And I try to listen. My dad used to raise all of us, my 3 sisters and I, to say, listen, God gave you 2 ears and 1 mouth. Try to respect his ratio and listen twice as much as you talk. And this is the longest I've talked on this call, but I'm about to wrap it up. That's what we should all do. The more you listen, the more you learn. And I've learned from all of you this morning. And I can't tell you how grateful I am. And I know the right thing to do is to have a mask requirement for our kids. Let's put them first instead of any other political consideration. They deserve nothing less from true leadership. So thank all of you. God bless all of you. We'll get through this together. I am confident of that. And we need good leadership to do it. You all are great leaders.
Thank you, Governor. I really appreciate your comments, and I really appreciate the experience that you are bringing to the state of Florida. You've held so many positions you know the state of Florida and its people so well. And we certainly need a caring chief executive. But before we sign off here, I would like to get back to Dr. Gwen and ask her a little bit more about that mobile unit that you mentioned, because it sounds like something that would or could be available in some locales to help with vaccination of students.
Yes, absolutely. We're actually doing that right now in Miami-Dade County. We are parking at schools, and parents are able to access our services either if their child goes to the school or not. So we have been doing that for the last year now, and we will continue to do so. We have 2 units actually, and one is exclusively dedicated just to vaccinating kids. And it's not just the COVID-19 vaccine, but it's also all childhood vaccinations. We have seen in the last year a decline in the numbers of children that are compliant with their childhood vaccinations. Naturally, it's because parents have been quarantining and not getting out there and getting back into pediatricians' offices to get their child vaccinated. So we are pushing for parents not only to get the COVID vaccine if their child is eligible, but also to get their kids all caught up with the required vaccinations for school. Because there's one thing that we do not want to have happen, and that's to have an outbreak of other preventable diseases such as measles and mumps, rubella, varicella. I mean, these are all conditions that we've been able to eradicate that can creep back in if children don't remain vaccinated against them.
Excellent, excellent. Ms. Leonardi, what is Broward County doing in terms of ensuring that children have access to the mask?
Great. So we since the beginning of the pandemic, we've been offering PPE to schools through CARES Act, ARP, and ESSER funds. And I also want to echo Ms. Gwynn or Dr. Gwynn's comments. We are also offering vaccines at various school sites, not just for COVID, but for the other vaccines that children need to get here in Broward County. So we're doing everything we can to take every safety measure possible to make sure that our employees and our kids can come back into schools safely.
Along with the executive order that our current chief executive signed banning the mask, there was also the threat of reducing funding to the schools. What was your school board's reaction to that dire threat?
So, it's my understanding that we have various legal counsels looking into, even the legality of this executive order. So the executive order really just asked the Department of Education to develop some rules around, parents' rights to choose masking or not. And so there's actually some legal questions out there about whether or not that's even valid. So, our school board is actively evaluating that, and we'll be discussing it next week at a special school board meeting on the 10th.
So rather than sending help to your school district and to your school board, you got a threat of removing the potential of removing critical funding.
Yeah, and that's kind of been his MO, right? Like he also, wanted to give teachers a $1,000 bonus, wanted to make sure his name is on it, but those teachers still have not gotten that bonus. And now the state is paying $3.6 million to a consulting firm to figure out how to distribute that money appropriately.
Understood. So what we know we need in Florida is a governor who truly cares about our children, a governor who respects the science, acknowledges the science, and implements the science. So thank you all for participating. I'm going to turn the mic back over to the governor one more time as we sign off here. Thank you.
Thank you, Pamela. And thank each and every one of you again, bottom of my heart. This is the way good governance happens. People listen to each other. Take your different expertise and appreciate them and respect it. And then try to implement what is a good common sense policy to do what's right for the people of Florida, in this case, the children of our state going back to school. So I can't thank you enough. It's inspiring to me to have the opportunity to listen to each and every one of you and gain your perspectives and your understandings from a teacher to a school board member to a physician to a wonderful moderator. And God bless each and every one of you. And Florida will be better for it. Thank you so much.
Thank you all.